Hi, I'm Payje Misegadis, and my presentation is about the future of orthodontics. I'm going to talk a little bit about the present and the past of them because I feel like it's important. So, some key terms before I get started, just the definition of orthodontics is the treatment of irregularities in the teeth, especially of alignment and occlusion, and the jaws, including the use of braces. 3D imaging is a non-invasive technique which allows a greater view of dental anatomy, revolutionizing patient comfort and orthodontic procedure and treatment planning. 3D printing is the use of technology to build dental models, removable appliances, customized brackets, and arch wires. 3D laser scanning is a non-contact, non-destructive technology that digitally captures the shape of physical objects using a line of laser light. And the main thing of my presentation is 3D laser scanning because it is a fairly new discovery, not even a discovery, but invention. So my main research question, I wanted to focus on moving orthodontics toward a more virtual 3D type thing. And so it was done on the use of virtual orthodontics for imaging and bracket placement with the addition of new orthodontic care into a new age. 3D laser scanning is the next most advanced technology for orthodontics, and I definitely will stand by that because I believe it is. So improving orthodontic technology. When applying braces, it is really crucial to place the brackets correctly onto the tooth for precise alignment. And a lot of the times, yeah, traditional braces have been around for a long time, but obviously technology has advanced and they've started to use more computer software to align braces and stuff, but it's still, like I said earlier, a relatively new discovery. And the study aims to advance the 3D imaging lasers and lenses for a more accurate and easier way to apply braces. I really want to push along the study of printing trays from the 3D image with brackets already placed in them because I feel like that will not only speed up orthodontic care, but it will also, I feel like, improve patients' maybe opinion on the orthodontist or the dentist because a lot of people have negative comparisons with both of those things. So what has been done in this field so far? Like I said, very little, but 3D printed ceramic brackets have been investigated and are the only available customized ceramic bracket. This is to help control first order orthodontics by allowing brackets to be bonded onto a strong part of the tooth while also staying healthy, which is very important in my opinion because a lot of the times the tooth might decay because of the bonding adhesive or maybe the way it was placed. And so I was doing a little research, and a research was done comparing the accuracy of virtual orthodontics to a more traditional procedure. And the research states errors in bonding position may be due to lack of professional dexterity and experience in an attempt to minimize human error at this critical stage of executing the treatment plan. An increasing number of studies have been directed toward redefining indirect protocols, with emphasis on those that have added computer-aided design / computer-aided manufacturing technology. So those are the types of technology that will scan the mouth and then essentially put it into a software to where you can place the brackets. And studies show that traditional braces do have the tendency to stain easier versus 3D printed brackets because that allows for a safer bonding technique and a more accurate and healthier one. So why is this such an important question? Well, technology is only going to keep getting more advanced no matter what, I think. So virtual orthodontics will speed up the process of braces and orthodontic care along with making it more accurate and precise by doing everything through a computer software. 3D imaging and printing provides a better quality to properly evaluate the mouth and position braces. So essentially, this 3D image can be transferred to a computer software to where you can see the whole mouth and you can essentially place the brackets in their precise, accurate positions for the most accurate procedure of orthodontics. And Georgian Dental, a dental office that uses 3D imaging in Canada, states braces have been one of the biggest benefactors of 3D imaging. It grants orthodontists the ability to treat patients with a more thorough understanding of the issue that needs to be addressed. Because of 3D imaging, patients or parents of patients can get a better idea of how teeth are positioned and why they need to be straightened. Ultimately, this helps people make a more informed decision. The bonding adhesive used in orthodontics, it stains and causes decay. So the ingredients contain something that isn't obviously healthy for the tooth, because even like cleaning and stuff might not help that staining after you remove the braces. It's in our everyday lives and advancing before our eyes, such as like in medicine, in education, in art, construction. So my proposed method is I researched and improved the 3D imaging and printing to be more precise and accurate, studying different lenses and sensors and lasers used in the orthodontic field to essentially find the best fit one that will take the most accurate and precise pictures and scans of the teeth. Computer software, I want to make a computer software, not necessarily make, but that allows alignment of the brackets for braces virtually, which essentially will make the lives of orthodontists way easier. And then 3D printed trays is what is like the newest thing, and finding the right materials for the perfect 3D printed tray just essentially set those brackets in there, and that's about like all you have to do, with obviously the bonding adhesive. So the participants, in order to find the perfect laser and quality of x-ray lenses needed, different subjects will be tested on with different variations of lasers and lenses. These tests will each be done on people of all ages to ensure it is compatible with all patients in the future. It can capture images of the mouth and teeth, but also the skull for a 360 view, which is essentially what you want, to be able to see all the problems going on with the teeth, what exactly needs to be done. And this technology does already exist. The aim is to improve it, and also it is still relatively new. So, and then for the other like printed tray part of it, I feel like using participants to test the different materials and which one's better, which one might not be the best. They'd all have the same length of time in braces. So the design. This research is designed to explore the different lasers and x-ray lenses within the technology used in orthodontics right now. Participants will be chosen at random for the tests on different types of machinery. So one might have a less advanced or magnified lens than the other, and one might be in between. It's just finding the perfect lens and laser to essentially take the perfect picture. This research designed the research designed for the 3D printed trays will be more of a specific study. The goal is to find people with generally the same tooth color in order to see which adhesive is the healthiest on the tooth. By using technology that is already in place and turning it virtual to place brackets on each tooth, a new form of orthodontic care will come into sight. The goal is to be able to place the brackets on the teeth using a computer software with a scanned 3D image that allows the brackets to be placed more precisely and accurately. So the procedure, first, studies will be done on participants, like I stated earlier, to narrow down the best levels of lasers and magnification of lenses for the best 3D image. A software will also be made in order to have the ability to place brackets for braces virtually, which is essentially the goal because, like I said, precise, accurate, healthier. The software, its ability will be to generate and download the 3D images taken and automatically place brackets on each tooth in the most accurate place. And yes, the computer might not always be right, or the orthodontist might want to tweak some stuff, which is completely okay. And then, yeah, like I said, orthodontists can adjust brackets as needed. And then models can be then made of the patient's mouth, and plastic trays will then be made using the 3D printing technology, with brackets already aligned and placed inside the teeth and ready to be put in the mouth. So some of these are just more of the advanced orthodontic technology right now, which I think are really cool. So this one right here on the far right shows just a scanned image. The middle picture shows a model where essentially the tray would be placed and made. And then on this next slide, in conclusion, With the use of technology and trial and error runs, 3D imaging and printing can be improved. 3D imaging and printing already exist now, but the focus is to make the lenses and lasers better quality for better images. 3D imaging is used to take full panoramic pictures in order to see all aspects of the head and mouth. Being able to place brackets on the teeth virtually and pinpoint exactly where the brackets need to be placed will help orthodontists speed up the process of braces, which I think is really important because people kind of have negative opinions on that part of it because of how long they either have to be in braces or how painful it is. So essentially, I feel like this would speed up the process. And the adhesive for gluing brackets has also proved to cause decay and staining, so finding a healthier way of applying braces was also done in the research. And these are my sources.